Good morning, good afternoon. Welcome to everyone who joins us for today's program about fighting the virus. I'm Christian Forstner at the Hanns Seidel Foundation in Washington, and I'm welcoming everyone here, also on behalf of the American Council on Germany, whose president, Dr. Steve Sokol, is with us too. Dr. Sokol will bring in your comments and your questions during the Q&A session at a later stage. So please use the chat function in Zoom, or send Steve an email at sokol@acgusa.org. And Steve will try to accommodate as many viewer questions as possible. This pandemic is far from over, and we are still in the midst of an unprecedented global crisis. In Europe, the numbers are going up again, with people vacationing abroad, partying at home, either way, neglecting social distancing recommendations. Here in the US, we know the alarming numbers, and even President Donald Trump recently admitted that the worst might yet to become. To have this transatlantic dialogue on how we fight the virus, how we flatten the curve, save lives, and safely reopen, this is a truly needed exercise. At the virtual CSU party convention of the Upper Bavaria district, it's my home CSU district, a couple of weeks ago, both the Bavarian Prime Minister, Dr. Markus Söder, and the State Minister, Dr. Florian Herrmann, referred to the unfortunate cases and developments in Georgia, in Florida, in California, where steps towards reopening the economy resulted in tragic spikes of COVID-19 infections. Today, we are privileged to have two outstanding policymakers who both fight at the forefront in this fight, in this crisis management against COVID-19. From Bavaria, Dr. Florian Herrmann. Dr. Herrmann is the chair of the Bavarian Corona Task Force. Dr. Herrmann joined the Bavarian government in 2018 as head of the State Chancellery and as Minister for Federal and European Affairs and Media. Dr. Herrmann is a lawyer by training. He received his PhD from the University of Frankfurt and the Master of Laws from the University of Pennsylvania in Philadelphia. Dr. Herrmann knows everything about Corona crisis management in Germany and Bavaria, and is a great supporter of the transatlantic partnership. So thank you, Dr. Herrmann, for joining us. From Washington, we're having Secretary Michael Chertoff. Secretary Chadov is a lawyer as well. He graduated from the Harvard Law School, was appointed US Assistant Attorney General in 2001 and federal judge in 2003. Most importantly, Michael Chadov served as Secretary of the Department of Homeland Security from 2005 to 2009. After leaving the administration, Secretary Chadov founded the Chadov Group and remained heavily involved in national and international security affairs. So it was a wise move by the mayor of the District of Columbia to ask Secretary Chadov to co-chair the advisory committee Reopen DC. Today's session will be moderated by Ann Marie Hauser, who is the Vice President of Public Affairs at the Hudson Institute. So Ann Marie, thank you for moderating, and I hand it over to you.
Great, thank you, Christian. Thanks for the introduction, and thank you all for being here today, and thank you for having me on to moderate. We're going to go for the next 30 minutes to both the State Minister and Secretary Chertoff. We're going to go through several questions, and I plan to ask them about how our two countries have handled the COVID-19 crisis, the role of government, and what is the path forward, and then we'll take questions from you at the end. So starting out with the COVID-19 experience and crisis management, our two countries have dealt with this in some ways similarly and in some ways quite differently. And our countries are, even though we share a federal system, we are different in terms of culture in some ways and also geography. And so State Minister Herrmann, let me start with you. So Germany's first COVID-19 case was documented near Munich in January, I believe. And given Bavaria's proximity to Austria and northern Italy, which, as we all know, had very high infection rates, you had to act very swiftly to prevent a healthcare disaster. I'm wondering, what were the initial experiences in dealing with the pandemic, and what steps did you take to manage the crisis in Bavaria?
Well, thank you very much, Ann Marie, for having me. Thank you, Christian, for the nice, friendly introduction. You mentioned, Ann Marie, the first cases. That was near Munich, and it had actually nothing to do with Austria, but it was a case at a company near Munich that has very close connections to China. And it was a Chinese citizen who had some seminar there and brought the virus and infected, I think it were eight people. And what we did was the normal fighting of a possible epidemic or pandemic situation. But then it was confined to those 8 people. They were taken into quarantine in a hospital, and after a week or so, the situation was more or less over. So we thought that that was it, or we hoped. But then it started again because the virus already had spread, not from that situation in Webasto, in Stockpile near Munich, but from other places, and especially from Austria, from the skiing regions, because back then it was the ski holidays, and from other places in Germany. And then it started again, and then we realized quite soon that we really had to react quickly because the spreading was out of control, I would say. It started to become out of control. It was in an exponential development, and so we decided to move fast, because one important experience is that you have to move quickly if you realize that you have to move and act. You cannot wait, because every day is a lost day. Every day you get new transmissions, you get new patients. And so we started closing down the big meetings of people, events and things like that. So we started, we closed down schools, which was quite important. And in the end, we said, well, people have to stay home, only can go outside for shopping, for what's that, Lebensmittel?
Groceries.
Groceries, you know, go for shopping groceries and go to school, go to work, but nothing else. And then it worked so that around Good Friday, we could see that the numbers were going down, and it stabilized until it area. It stabilized, and we did not suffer what we feared. That would be the worst case scenario, that our medical system would collapse, that our hospitals would collapse, and we're not able to take care of patients anymore. And that did not happen, fortunately. And that is always our guideline, because we had the experiences from, we saw what happened in Italy, in northern Italy, in Bergamo. I read reports from Strasbourg, where a big university hospital, like hospitals we have in Munich, could not take care of elderly people anymore, of patients over the age of 80 who were infected and had symptoms. They were not cured and taken care of by doctors anymore. They were only treated palliative. And this was also a scenario which I could not stand. And when a brother-in-law of mine who works at a hospital in Munich told me, I think in March, well, last week we had the triage information, how to deal with patients if it's going to be too much for us. And that for us always was the worst case scenario, so that we do not reach this state of the catastrophe. And so far it worked, but the situation at the moment is sort of between stable and unstable, because we have a low number new infections on a daily basis. But at the same time, we know that the virus is still here, that more than 95% of our people are not immune, so they could be infected, they could suffer from COVID, and we don't have a cure, we don't have a vaccine so far. So we really are very careful, and our strategy is careful, careful, careful. Don't open up everything at one moment. At the same time, go on a 10 to 14 days basis, step by step, because we now see, for example, in Israel, for example, also in parts of Austria, but I also read about Texas, California, that they have to go back again, that they close down bars and places like that again. This is what we don't want, and especially we don't want to get back to the exponential development of the virus. And so that is our strategy, take care of or taking measures that make it possible to stop transmitting the virus. So that's why we have the masks in Bavaria. That is why we still want the people to, well, avoid contact. It's not ordered in a very strict way, but we try to avoid contact. We have the masks and we test. And that's the last point I want to mention. We, at the moment, I would say, tripled our capacities in testing people because we, for example, in the rural area, we have some outbreaks in farms where they have people from Eastern Europe now to help during harvesting. And there we have some outbreaks. So we test all these kinds of workers from Eastern Europe now. So to make sure that there is nothing, that there is no infections. And if there, we have the quarantine over the farms. So therefore we need a huge capacity. And what we are facing now, because in Bavaria the summer holidays just started, but in other federal states they come to an end. So we have people return from holiday, and especially people who visited, who live here and work here, but visited their families, for example, in Turkey or in other countries in Eastern Europe or Middle East or so. And they come back, and that's also a challenge, so that we do not import the virus again. And that's why we have the testing capacities at our airports, that we have testing capacities, especially when school restarts in September, so that we are prepared to avoid a second major outbreak of the crisis.
That's great. And I just have one quick follow-up. As you are the head of the Bavarian Corona Task Force, and the success that you've had in Munich, have you been able to share those best practices with other parts in the country, other states, and have they been receptive to that? I know that Munich has fared, the way Munich has handled it, I mean, you were hit hardest, but you handled it very successfully. Have other states in Germany borrowed tactics and some of the testing and the preparation that you have done, do you believe? Or
yes, more or less, it's more or less the same strategy in every federal state in Germany, because we have the chancellor, our federal chancellor, Angela Merkel, and her head of the state federal chancellery, and also our Secretary of Health, Jens Spahn. They guided more or less the federal level, and together with our Minister President Markus Söder within the group of minister presidents in Germany, they guided us through the crisis. And of course, there have been different approaches due to different number of cases. So there is a huge difference between Bavaria, Baden-Württemberg, North Rhine-Westphalia on the one hand side, and maybe Mecklenburg-Vorpommern or Schleswig-Holstein on the other hand, because that is different due to travel practice and whatever. So it's justified that you have different kind of approach, but in general, more or less, it was always the same approach: closing down schools, closing down social life, testing, and so on. So it was more or less the same, but I would agree that in many cases, Bavaria took the lead because of our experiences. So but it was really a very good cooperation between the federal states and the federal level.
Yeah, I think I read somewhere that you were more prepared because in 2014 you had established a task force after Ebola, I believe, had come to your state. Is that true? There was, I'd read that in my preparation.
Well, I'm not aware of that because I was not in office back then. Yeah. But we of course have a good experience. You would call him Surgeon General. We don't call him in that position, but our president of our state, I call it,
Center for Disease Control.
Yeah, CTC president or whatever you call him.
Right.
He is an experienced doctor, and also the Ministry of Health is experienced with a couple of pandemics or epidemics that we had in the SARS, for example. And so they built up experience and know-how which we could rely on. But of course, we did not had, like the whole world, any experience with a pandemic like that.
Right. Okay, great. Thank you very much. All right, Secretary Chertoff, moving to you. You were the head of the Department of Homeland Security. You're no stranger to thinking about potential domestic threats and how to manage them. If you could speak some from your experience as Secretary, that how much thought was given to the possibility of a pandemic like COVID-19? And also, were we adequately prepared to meet this current challenge? And maybe what did we do well and what could we have done differently to prepare?
Well, we actually focused on this issue when I was Secretary back in 2005. Because we were concerned about a biological attack from terrorists, but also because there was avian flu. And we realized we would be periodically encountering these kinds of medical pandemic challenges. So we actually put together a very detailed plan. We exercised it, we trained people. We even had a couple of nationwide exercises based on the idea of some kind of a pandemic. And when we actually transitioned to the Obama administration, that January, we ran an exercise with the incoming officials to get them acquainted with how to deal with these issues. So we were well prepared. I think what happened, to be candid, over time is there was a certain amount of complacency that grew up. Particularly with the incoming Trump administration, I think they disbanded some of the mechanisms that had been in place to deal with pandemics, and therefore they were less well prepared than they might have been. And that's, recognizing that this is a very challenging set of issues because of the size of the country, because of global travel, and particularly because this virus is a little bit insidious in that people can be infectious before they become symptomatic. In a funny way, when you have a very violent or virulent pathogen where you get sick right away, people naturally stay home. What makes it very tricky in this case is people may appear to be perfectly healthy, but in fact they're brewing an infection, and that, I think, always makes it a challenging issue.
That's really interesting, and that's it, and kind of scary when you say brewing an infection. That's an illustrative phrase, but it's a good motivation to get people to stay home if they want to leave. Do you think there are things that we could have learned from experiences in places like Bavaria? I know Germany has really been held up as the model for how to do this. I think, like I said earlier, our cultures are different. I mean, everyone comes to America, and Germany is diverse, but not America diverse. And we have a lot of, in Germany, you have there's the order, following orders, a German American. I get this, I appreciate it, but I live in America, and I know that it's, when we tell people to shut down, we did it for a while, and then until we didn't. It's a really interesting time in our country, which we'll get to, but I just wonder, are there things looking back that we did do well that helped us in the beginning, but that we could have done differently, specifically for this pandemic?
Yeah. Well, I think that, Germany moved very quickly to respond to these issues. We were somewhat hesitant on a national level. And there was a minimization of the issue at the very beginning. Then we did put in a partial travel ban with China, but it turns out Europe was actually the major vector for bringing in the infection. And then we had, shall we say, uncertain and mixed messaging from the White House about what was going on. One of the key things you learn is if you're trying to get the public to cooperate in a nationwide effort, you've got to be consistent and clear in what you're doing and why you're doing it. So as an example of a place that actually did a reasonably good job, New York, when they experienced the spike, you know, the governor was on there every day and he was clear about what they needed to do and why they needed to do it, why they were shutting down, why they were restricting gatherings of more than a few people. And that helps people calibrate their response. I think what happened federally is there were literally contradictory messages coming out of White House briefings between what Donald Trump said and what, let's say, Tony Fauci said. And then at some point, the White House said, you know what, we're going to turn it over to the states. And that led to a patchwork of responses, some very good. And I might say in the District of Columbia, as well as Virginia and Maryland, the leadership was, you know, very energetic in responding. But then you got places in Florida and other places down south that treated it as if it was a joke. And then they're seeing the results of that with a huge spike now. And unfortunately, some of that is spilling over into the states that did a good job because of the fact that people travel within the country.
Mm-hmm. Yeah, I don't disagree with you on the mixed messages from the White House, but I think the medical community also gave mixed messages. Yeah. It was, don't wear a mask. No, wear a mask. Or, you know, oh, it's on your mail. It's not on your mail. You know, it's on surfaces. And so I think there's a frustration among, you know, Americans. And I'm glad to see the White House, you know, the president is wearing a mask now. And I just think, why are you going to die on this hill if wearing a mask or not? Just wear the mask, right? It's been...
Yeah. And Ann Marie, I would say this, I mean, to the point about the medical community, and I agree, there was, it was too quick a rush to come out with assertions that turned out not to be well supported. Some of it is the media ran around and hunted, quote, experts in various institutions, each one of whom would give a different account of what was going on. And that led to the sense that maybe people don't know what's happening. The other thing I would say is this, and I wrote an op-ed about this about 3 months ago. You have to be clear what you're trying to achieve. What we always tried to do in addressing the issue of a pandemic was manage the risk, reduce the risk, but recognizing you can't eliminate risk because risk is part of life. Mm-hmm. So you try to balance reducing the risk without having such a draconian regime that you basically shut the economy down and people start to suffer from other things, like they're not eating or they're having other illnesses. And sometimes the medical community acts as if we're going to try to arrange the way people behave so that nobody ever gets sick. That's not possible on a human. And to do that, you would have to literally destroy the country. So what we needed to get from the medical community and the political leadership was a clear assessment of what is reasonable to do in terms of managing risk, recognizing there are no guarantees and people who are vulnerable need to take extra precautions, but also not going too far in the direction of trying to make everybody shut down, which winds up having other seriously negative consequences.
Yes, some of the headlines about the bad effects of shutting down are really scary, from abuse to, you know, suicide, people having cancer who can't get treatment. I mean, it's been, yeah, I think in the beginning, every night I just said, thank God I'm not one of the political or medical leaders right now, because this is really uncharted territory for our world. So, well, thank you for that. That's
jump in for a second, if I might. I would say the first, I would agree with a lot, and I think the most important point for decision makers is to accept that this all is a complex catastrophe. So that it's really complex, that it's not a simple catastrophe. I mean, we are used to simple catastrophes, maybe some landslide or maybe even terror attacks are not as complex as this kind of catastrophe, because it affects, I would say, everyone, literally everyone on the whole world, and it affects all situations of life. It affects children in school. It affects our whole working life. So everything, and that is complex, and it's not enough to just take care of one issue or of one aspect of the whole situation, but to take into account everything. That makes it extremely complicated, and that makes it also a playing ground for some conspiracy theorists and people who love simple explanations. And that is also a challenge, how to deal with it. Because I think we learned, especially in Munich, we learned in the beginning that everyone is learning, especially the doctors and the experts. We had, as I mentioned, the cases in the beginning, and they were luckily easy cases. So nothing happened to the patients. They were little, as far as I recall, a little. I mean, they had symptoms, but not severe. And after a week, everything was fine. So even the doctor, and he's really an expert, he said, well, obviously, the consequences are not so bad. But of course, he would not repeat that now, because now we know much more about it. And we always have to realize that it's now 7 months that we know this virus. In Germany, for example, we know it for 7 months. And therefore, we know a lot compared to former viruses. For example, the Spanish flu. The experts in 1918 knew nothing about it. They learned about it over the period of 10 to 12 years, and in the early 30s, they understood what really had happened and what the virus was about. So we really know a lot about this virus, and at the same time, we know nothing, literally nothing, because we don't have a cure, we don't have the vaccine, and we don't really have understood what kind of organs might be infected. Is it really only the lung, or is it also the heart and other organs, and so on and so on. That makes it very difficult and complex, but we simply have to accept that we are in the midst of the pandemic and in the midst of the situation, and not at the end. And that is honestly quite difficult to explain to some people, because they think, well, what is the problem? We don't have new cases, or only, for example, in Bavaria, we have around 80 to 100 new cases a day, which is not so much compared to the 2,000 a day we had in March. So that is almost nothing, but it's still a virus, and it's still a pandemic, and it can speed up again to 200, 2,000, whatever, many cases a day. And so that is so important to understand. First of all, it's a complex catastrophe, and second, don't mess with the virus. Don't underestimate it.
Right. Right. Just a little programming note. If you all just want to remind the viewers, if you have questions, please use the chat function on Zoom to send in your questions that we'll get to a little bit later. I do have one question here that I wanted to go ahead and throw out to both our panelists from regarding the Johns Hopkins site today. And it indicates that Germany has had much lower case rate as proportion of the population, so 208,000 out of 60 million, but also has an appreciably higher death rate of 4.4%, where the US death rate is 3.4%. And I know that's been a big conversation in the media. I will say, as someone who works with the media and follows them closely, and I'm not bashing the media, but there has been a lot of lack of reporting of weighing it per capita, right? And so it just sounds like America's about to fall off the face of the earth with COVID. Meanwhile, everything's fine in Germany. And I just think that's a huge misperception, and these numbers play that out about the percentage of the death rate. I wonder, Minister Herrmann, if you want to speak to that, or even Secretary Chertoff, if you have any thoughts on that.
Well, I would say the death rate is one number that is important, but not the only number. And that's what I meant with complex catastrophe. There are so many different numbers and figures and benchmarks and whatever. You have to have them a view on any of those benchmarks. That's important. I can't really give you a scientific approach now to the different percentages. Sometimes it has to do with the counting. Who is counted as a COVID patient and a COVID casualty? So I'm not sure about the numbers. On the other hand, it might has to do with the fact that in Germany, or maybe I only can speak for Bavaria. In Bavaria, it was the elderly people, the older people who were infected in the beginning more than younger people and suffered more severe symptoms. So that might be a reason. But I always say it's not the only point. It's for example, it's always important to see how many intensive care units do we have, how many beds do we have and do we provide, and is there a shortage or might there be a threat of a shortage, for example. That's important. Or the question, how many new infections, how is the rate of how many persons are infected by one infected person. So because that shows us, is it in a linear way, is it contained, or is it already in an explosive or exponential way again. So it's so many different issues. You cannot judge on the strategy or on the situation only by pointing out this or that benchmark.
Yeah. That's well said. Secretary Chertoff, did you want to add anything to that?
No, I think this is a cautionary lesson about the importance of being very careful in evaluating statistical evidence. Sometimes, I said for a long time when they were doing the mortality rate that was very high, I said, make sure that you have the denominator, the total pool of cases, because if cases are asymptomatic and not being reported, those are people who are infected, but they're not having any negative consequence. That lowers the mortality rate. And then the other issue becomes comorbidity, the question of whether people have other conditions that are exacerbated by the virus. Does that mean it's a virus death? Is it something else? So I think, again, we have to be careful on the messaging, not to read too much into a snapshot of what the figures are.
Yeah, no, I think that's right. And I think it is incredibly complex, as you said. And these numbers are a lot. It's not something that you can put in a tweet and get a full sense, right, of the whole story. It's a longer discussion. I wanted to, if I could, we've probably got about 10 minutes before we'll go to more questions, but I just had one question. We mentioned, obviously the big issue is finding a vaccine, reopening schools, get the economy back together. But, China, we talked about China earlier. It came to Munich from, I believe it was an auto manufacturer, someone who worked in China and was there, and you guys jumped on it and dealt with it. But we're seeing public opinion polls changing in Germany. I've noticed it more starkly. I think America has been more aware of our relationship with them. But in Germany, I wondered, I'd like to go to you first, Minister Herrmann, and then you, Secretary Chertoff. How is that going to, with the opinion polls changing in a negative direction of how Germany or how China has handled this, and that COVID came from them, how is this going to affect perhaps how Germany is going to handle the trade relationship? I mean, it's a massive export market for you. And then also with the 5G and Huawei, is that going to, you see in the UK, Britain was like, we're done, we're out of Huawei, no, right? And so I wonder if that's going to affect, that public pressure is going to affect things for the government. And then Secretary Chertoff, I wonder from the American perspective, there's a cybersecurity angle, are we going to reshore our supply chains and that's, and also our trade relationship. So Minister Herrmann, if you don't mind going first.
Sure, thank you. I think that is one a very interesting and good question, because you can see, I would say, a different approach in our politics and in US politics. Because, to be honest, we don't blame the Chinese. We don't have this kind of discussion, which I read in the news that you have in the US about the Chinese virus and things like that, and taking them, I don't know, suing China and whatever, and blaming the World Health Organization and things like that. We don't have this kind of discussion here. So of course the virus came from China. That is, I think, undoubted, because we saw the reports when they fought the virus back in the beginning in January and this year. And we even supported our partner regions. Bavaria has 2 partner regions in China. We supported them with stuff, with material, with whatever equipment, as good as we could. We did not think that we need help ourselves a couple of weeks later, actually, but anyway. And so there are, of course, effects on the chain of supply, and it really affected our automotive industry, but only because of the facts, because they closed down factories over there, and we had to close down factories because we didn't get the supply chain anymore. But it was not any kind of political decision that we say, well, they are bad because they brought us the virus. I mean, the virus is
regardless if they're bad or not, I think there's a breach in trust of a relationship of, you know, there's a sense, and this isn't political. I mean, I think it's been documented that they omitted, you know, they had early mistakes too. You had their doctors being stifled or disappearing when they were calling this out. They're kind of showing, right, how they handle with these things, which is much different than you've handled things. And so I think it's less about blame, but more about, is there, and I've seen, it's been interesting to conversations I've had with German friends who were kind of, you know, China's not a problem. And 7 months later, they're like, China's a problem. And I think there's just a mistrust that because of their behavior is what I'm getting at.
Well, maybe as a politician from Bavaria, I'm maybe not into the international relations of Germany in general. We of course, as Bavaria, have our international relations with the regions over there, and so I'm maybe not aware of all the implications. But our medical experts and our scientists always told us that there is an excellent exchange, and that the Chinese published everything they researched, and there are so many new papers every day and every week, and that they learned a lot from the Chinese doctors, and that helped a lot in being prepared for the first wave here in Germany. For example, Professor Drosten published things like that. He's one of the famous coronavirus experts here in Berlin. So that I, of course, read about that the Chinese also suppressed information, that they did not publish in an early stage and did not inform HWO early enough and things like that. I read about that, but what our experts told us is that there is a good exchange and participation on what they learned about the virus over there because they published it and so on. So I just want to point out the question, who is to be blamed for things, is not a very vivid discussion that we have here.
Okay, thank you for that. I'm glad to hear that the doctors had a good exchange. Secretary Chertoff?
Well, I think, you know, the issue in China is a broader issue. One thing I might observe is we've charged some couple of Chinese in the last week with engaging in cyber espionage to get data and information about vaccine development. And of course, the issue of theft of intellectual property and espionage has been a persistent problem between the US and China. But I would say more generally, what you're seeing with Huawei is a concern that the Chinese have become much more aggressive about exporting their agenda using all the levers that they have, military, economic, social. And frankly, that's creating a geopolitical issue. I mean, we've seen, for example, instances where the Chinese don't like the fact that someone has the word Taiwan on a map. So they threaten Marriott, we're going to shut you down if you don't remove that. Or where they're requiring, for example, that social media platforms make available to the Chinese government all the data and all the information that people are posting, that is a concerning issue. And I do think that particularly when you see the fragility of the supply chain, which has been exposed by the pandemic, because as you rely in other countries and if they shut down, that affects you and your economy. I think it reinforces the importance of having multiple sources of supply. And to be honest, one of the things that I've been active in doing is urging the so-called liberal democracies in Europe and North America and even the Southern Hemisphere to find alternatives to Huawei, Ericsson, Nokia, Samsung, because I'm concerned if Huawei monopolizes the infrastructure of 5G, at some point, if there's a dispute with China, China will order Huawei to simply turn it off. And that would create a real problem. So to me, one of the broader lessons of the pandemic is you must have resiliency. And sometimes that means alternative methods of satisfying your requirements.
Yeah, no, that's right. And I think you articulated that very well. They have really shown this more aggressive side of their agenda, and it's been I think a little scary to watch. So let's see here. We have a viewer question on cyber. Has Germany seen the Russian hacking and disinformation efforts related to COVID at all? And then we'll do that, and then we'll I'll pitch it back to Steve. Have you seen?
I'm not aware of that. I don't know. But of course, there is a lot of, I would say, conspiracy theories and disinformation going on online. Who is the author and where it's originating from, I don't know. But of course, we have that for many years now, because that is one really serious issues of social media, of social bots and things like that. And we know that there are some, I would say, forces that try to destabilize Europe and Germany and our societies. And and that is done by any kind of cyber attacks and things like that. But I don't have any information about the actual situation talking about coronavirus.
Okay, that's good.
So let me join you now. We've had a number of questions from our viewers about the role of government, and let me pose the first question to you, Secretary Chertoff. When you were in government, what was your department's understanding of the roles of the federal government and the states in the event of a challenge like a pandemic?
Well, generally the view is the federal government would coordinate a national response to the pandemic. Now, the actual execution of the plan would have to be done in cooperation with the states, which have not only certain authorities, but they have the resources to do some of the things that would need to be done medically, as well as in terms of emergency services. But the idea would be to have a unified federal approach, because when you have multiple approaches within a single country, one state may do a great job, one state may not do a good job, and the state doing the right thing is going to still wind up suffering. So this is a case where unity of effort among all levels of government is very, very important.
Thank you. And Minister Herrmann, you said earlier in this conversation that each of the German states has responded very similarly to the way in which Bavaria has responded. But can you talk briefly about the role of state government vis-a-vis the federal government in managing a crisis like this pandemic?
Yes, I think it's part of our federal system that the state governments are responsible to take the necessary measures in situations of catastrophe, emergency, or epidemic or pandemic situations. And that is also, I think, a very good idea because you have so different situations. as we learned also in this particular crisis, we experienced that. And at the same time, you have the federal level who makes the law in fighting pandemics. So it's a federal, more or less, I would say, a unified federal framework, legal framework, with the measures you can take, and it's the decision of the state governments what to do in particular in the actual situation. And also you have the federal government to assist, for example, with funding, or in this situation with taking care of acquiring material which we needed, which we were out of stock at a certain point. So that was a very good, I would say, a very good cooperative approach that we had.
Thank you. And Secretary Chertoff, one of the things that was mentioned in the introduction is that you are the co-chair of the advisory committee Reopen DC. And of course, the goal of this initiative is to develop a safe and sustainable way to open the District of Columbia. As all of us grapple with things returning back to normal or some semblance of back to normal and try to come out of the lockdown, can you talk a little bit about the district's response to the crisis, and also, again, how the state and federal roles in managing the crisis are playing out in DC?
Well, I would say, of course, the District of Columbia has a somewhat unusual challenge because it is the seat of government. So you get a lot of travel from around the US, as well as a lot of people from other parts of the world who are residing here. And also we are very, very closely linked to Maryland and Virginia because many people commute back and forth. And that means we have to coordinate well with the governors of those two states. I think the mayor was very deliberate in putting together a panel that would come up with a plan for gradually reopening DC, conditions permitting. And Susan Rice, the former National Security Advisor, and I co-chaired it. And the idea was to set certain metrics in terms of reduction of cases and the availability of medical and hospital resources. And as we hit certain milestones, we could get to the next phase of reopening. So the first phase was very modest. Outdoor dining, essential workers could go into work. The second phase is a little broader. It allows some indoor dining, but spaced with social distancing and masks on the part of the employees. We are still in phase two because unfortunately, the numbers are not decreasing as much as we had hoped. So that's keeping us kind of at pause. And one of the big challenges I think coming up is what will we do about school in September? Because there's a concern that schools are a potential hotspot for people getting infected. At the same time, the kids need to learn. And frankly, sometimes parents need to have their kids in school so they can do essential work. So, I mean, I think it's a great example of the mayor and the leadership of the city being very responsible in recognizing the competing requirements, not insisting on total elimination of risk, but trying to calibrate so the high risk things don't go on, and we try to come up with a reasonable balance.
Okay, that's excellent. This is a rich topic, and I know we could probably go on for much longer, but I'll just say to both of you, as we wrap up here and we finalize, just broadly speaking, are there any lessons that we have learned, you know, here we are 5-7 months in to this, that we would do differently or that we could do differently now as we work to combat this and get our lives and our economy back to order?
You know, speaking for myself, I think one of the things that handicapped us and continues to do so is the shortage of protective equipment and testing, including rapid assessment of tests. And I think what we need to do in the future, because we'll get these again, is to stockpile protective equipment, stockpile the material and the chemistry you need for the testing, have a detailed plan about how you would deploy this quickly in the most efficient way, and rehearse it so that if and when something happens, you can immediately get people what they need to protect themselves and also get them in a testing and contact tracing regime. One thing which I think I'd be interested in hearing the minister's view on is there are now online apps that can be used for contact tracing. That if you're infected, anybody you were close to based on your Bluetooth will get a notice on their phone that they may have been infected by somebody. They won't get the name. In many ways, that could be a very useful tool, but there are obviously real civil liberty and privacy concerns about how that data is managed. I think it would behoove us, not just in the US, but frankly, again, all the liberal democracies, to study the question of how we might get the benefit of this technology, but put into place protections and guardrails against it being misused for bad purposes.
Minister Herrmann.
Well, I would agree that we have to improve everything that you can have on stock to be prepared. That is important because we were out of stock as well. On the other hand, side, I think we have to improve, and I'm talking about Germany, improve our public health system. It's especially the local public health agencies that are those people who take care of the contact tracing and things like that, because we thought for many years that they are not so important anymore, and I think that is a mistake. So because they have to be ready to respond, to quickly respond to outbreaks of any kind of infections and viruses and things like that. And we have to maintain our hospital system and also try to improve it. But that is one lesson we also learned, that our hospital system was quite ready to deal with the situation. For example, we had, before the crisis, we had 34 intensive care beds at our hospitals by 100,000 people. For example, in Italy, they had 12, and in the Netherlands, they had 7 intensive care beds by 100,000 people. And that shows that if you have a good level of hospitals, which we have not only in the big cities, not only the big famous and powerful university hospitals, but also in the rural areas, the county hospitals. If they all are on a certain level, you can deal with the crisis and with a huge number of patients much better than if you don't have this situation. And last point, in general, I think for me the lesson to be learned is don't mess with the virus, because the virus is deadly. And that is what our society in Germany, maybe in the US as well, in all Western countries, is not used to, because any kind of infections, of virus, of bacteria infections, we successfully fought and in most cases defeated over the last 100 or 120 years. So everything our great-grandparents possibly died of, we don't die anymore of, because, for example, polio or tuberculosis and all those kinds of illnesses don't exist anymore, or there is a vaccine, or there is a medical cure. So our generation is afraid of cancer, is afraid of dementia and Alzheimer's and things like that, but not of viruses and bacteria. And in a case where you have, like this case, where you have a new virus, where you don't have a cure and don't have a vaccine, it will be deadly. And that is something you have to always keep in mind and maybe understand and learn as society in general.
So in the last couple of minutes that we have, I'd like to fold in a final viewer question. And it's sort of interesting, up until the last few seconds, we haven't talked at all about a vaccine. We've talked about hospital capacity, about PPE, about tests, about contact tracing, but a vaccine has not come up. And one of our viewers writes, looking ahead to the hopes of a vaccine by early 2021, how would you contrast the American and German public response to vaccination? And what should the government strategy be as a result? She cites opinion polls that suggest that in the US, as many as a third of the public might not get a vaccine, even if it were available, and wants to know whether Germans are more positively disposed to a vaccine. I guess as closing thoughts to our conversation today, Minister Herrmann, I'd love to hear your thoughts about Germany's response to a vaccine, and Secretary Chertoff, what your thoughts are about a vaccine and usage of a vaccine.
Well, as I just said, since everyone is used to the fact that you most likely won't die of a virus or any kind of infection, we have, I would not say many people, but some people who really doubt the necessity and the usefulness of vaccination. And I'm not sure if it's 1/3 of the public. I would say it's less. We have polls that say if there was a vaccine against coronavirus, more than 65–70% would take the vaccination, which would be enough. I mean, around 65–70% would be enough to have the immunity for the whole population. But there are these conspiracy people who doubt everything and who doubt the vaccines, and then you have all the conspiracy about the Bill Gates and Melinda Gates Foundation, and that they whatever those conspiracy theories. But it's really, I would say, 10% hardcore people in Germany believe such kind of theories, and everyone else more or less is, I would say, reasonable.
I think that's true for the US too. I'm hopeful, as Tony Fauci says, we'll have a vaccine available early next year. I think most people will take it. Those who won't may wind up paying the price, although I think we may wind up getting herd immunity. But yeah, we have the same conspiracy stuff. And this seems to be a feature of the modern world of social media. And the question is, when push comes to shove, whether people will realize the risk they're placing themselves in if they don't follow good medical advice.
Well, on behalf of both the Hanns Seidel Stiftung and the American Council on Germany, I would like to thank all of you for this insightful and rich and thought-provoking conversation. There are a number of issues that we've not even sort of scratched the surface on that would be fascinating to get into as well. And they include things like talking about schools, but also the possibility of international collaboration in meeting this common challenge moving forward. Undoubtedly, all of us will have our hands full as we try to tackle this. But Ann Marie Hauser, I want to thank you for guiding us through this wonderful discussion. Secretary Chertoff, thank you for being with us from Washington, D.C. And Minister Herrmann, thank you for joining us from Munich and sharing with us the work that you've been doing in Bavaria. This has been a fantastic discussion. So a huge thanks to all of you for this.
Thank you, Steve.
Yeah. Minister, and thank you, everybody. Stay in touch.
Thank you.
Stay healthy, everybody.
Bye.